Just whatever you can, we appreciate it. No problem.
Yeah, looking forward to hearing everybody's commentaries today, especially with the surge we're seeing locally in Southwest Missouri. So I'll be monitoring.
Okay, that's probably what we're going to be talking about. I pulled up some information, and I was going to be kind of trying to start the conversation with that. Chad, can I have your call once more?
Yeah, it's KE0RUZ, Kilo Echo Zero, Romeo Uniform Zulu.
A0R, you said. Got it. Thanks, just for the log. All right, is there any other early check-ins for Marco Net? This is WA1EXA.
November 3 Indian Mike will be short term.
Okay, November 3 India Mike. Gotcha. As long as possible, it's fine. We appreciate it. Whiskey Delta Golf Echo Tango, Celebration, all to be short term. Okay, can you repeat that one more time, please? I just didn't catch it. Sure, it's Whiskey Delta Niner Golf Echo Tango. Whiskey D9 6. Yeah, Whiskey D9 GC8. Got it.
This is M5 RTF, Chip in New Orleans.
Gotcha, Chip. No problem. This is the Marco Digital Net. Your net control today is WA1EXA, Mark, Cape Cod. And looking for check-ins. Looking for check-ins. Go ahead. Sounds like a small group today. Again, this is the Marco Digital Net. Any check-ins? Must be summertime. So I have three check-ins, two of which are short time, and one that Chip said he'd be here. Again, this is WA1EXA, a digital Marco Digital Net. Meet every Saturday at this time on QuadNet, and everybody kind of knows the rules, so I'm not going to go through them. We'll just keep it informal. Today, I guess the big news is that what a week makes, and we're having outbreaks throughout the country. Looking at the latest information on the New York Times data, we see an uptick in all areas, with the greatest in the state of Arkansas. As far as hotspots, Missouri, Arkansas, Louisiana, Florida, parts of Texas, a couple of places in Alaska seem to be the hotspots. We have nationwide the break one. Nationwide, we have 48% of all ages vaccinated and 56% having at least one dose. And as far as vaccinations in Vermont, Massachusetts, Maine, and Connecticut, Rhode Island are on the top of the list. The number of hospitalizations have not increased that much, although nationwide there's been an increase of 30%. It varies from state to state. Some states have slower decline. We have a decreasing number of tests, but that's kind of a difficult number to gauge because people are doing their own tests now and probably not reporting them. The at-home tests are becoming very popular. So that's the state of things at the moment, and we'll see if there's anybody else new there, or if not, we'll pass it to Chad if you're still there. On WABNEXA. Hey, Chad, you have any, that's N0RUZ, any comment?
K0RUZ chat. Yeah, it's still running pretty rampant down here in Southwest Missouri. We know that most of our regional hospitals are full and at capacity, seeing higher numbers now than we have at any other time in the pandemic, and still remaining very significant percentage, greater than 90% are unvaccinated. So there have been a lot of grassroots efforts to try to improve vaccination rates, but they're still very, very sluggish down here. So hopefully we'll get some movement on vaccination and begin to stem this. But I think we're in this for the long haul based on what we're seeing at this point. Over.
Very good there, Chad. Yeah, according to the Times, Missouri had a 46% increase in hospitalization, 14-day change, and is probably number 2 in the country. So I see where we fit in there. Okay, and N3IM, are you there? WABNEXA.
This is N3IM in the group. Yeah, in Pennsylvania we've had 5,796 people who are partially vaccinated, and 5,592,000 who have been fully vaccinated, for a total vaccine administration of 11,388,000. We're seeing some Delta variant in Pennsylvania. We've had a slight increase in the COVID, particularly Delta variant, but I think the death rate has dropped off at this point. And that's all I have to say. This is N3IM. Back to Marco Quadrant.
Okay, the picture seems to be very similar. The states that have the highest vaccination rates tend to be the ones that have the lowest um, rates of infection at this point with a new spike. They are calling this the fourth spike. I've heard that on TV, and I've heard it also reported in the literature. Okay, over to WD9GET, WA-WXA. WD9GET. Al, I didn't quite get that. Could you repeat it, please? I guess he went away. Chip, how's things down in New Orleans, WA-WXA?
This is N5RTF. Good morning to the group. Yeah, as far as COVID is going, I was looking at some numbers just now, and it's definitely going down, at least as far as impact. We had about 1,100 cases in New Orleans last week. I think we had, in Louisiana, and had a total of 3 deaths. There's nobody currently on ventilators. This thing, it seems to be just sort of winding its way down. We're also up to about 40% vaccination rate, getting real close to 40%, which is actually pretty good. If you consider that our literacy rate is only 61%. N5RTF.
Yeah, that considering what you're working with, that does seem to be a good number. According to the according to New York Times, Louisiana has. I'm trying to scroll through this. This would be a statewide number. Louisiana, 36% of the state is fully vaccinated, and while hospitalizations do tend to be increasing in Louisiana, it's up 72%. It's only 9 per 100,000 people. Not that only is a bad thing. It's sometimes percentages are not really reflective of the actual numbers. And as far as the Cape is going, as I said, Massachusetts is fairly stable, but the Cape has had an increase, particularly in Provincetown, and that is primarily due to the small area that's up there and the massive number of people that come up during the summer. We seem to it seems to be directly correlated with the well, really there's no space with all the nightclubs and restaurants. Are all very small. If you're familiar with Provincetown, and the area of the town is also very small, and it usually like triples its population at this time of year. This year is probably more than that. We've had a very strong tourist season. So the towns like Provincetown that do draw a lot of tourists, it is a problem to the fact that the state is sending up more testing units and vaccination units. But vaccination doesn't seem to be the issue. The issue is just close contact. So there really not much I can do about that other than stop people from coming into town, which is not going to work commercially. And that's kind of what they're putting at this point in time. We have not seen any increased hospitalizations, although the cases tend to be on the mild side and not require any hospitalization. So we believe that the virus is ongoing to people mostly that are vaccinated, and that's something that we kind of expected, I guess. Break there for a minute. See if there's anyone else that hasn't checked in. Again, this is the Mark Monette. Any check-ins? It's going to be a small group today. And anyone have any comments regarding the Pfizer that is announcing that they want to look for approval for a third booster, for a third shot? I know that that's not being recommended yet by the government, but I know Pfizer is strongly pushing for it. Anyone have any comments on that?
N5RTF.
Go ahead, Chip.
I wanted to follow up on my earlier comments. The tourism, as you mentioned, has been a major influencer down here. New Orleans got hit really hard early in 2020. In fact, there were cases in the fall of 2019. Looking back, I can think of myself and 5 other cases of people who had all of the COVID symptoms, very ill, one hospitalized, and of course nobody even knew about it back then. But being a tourist destination, we got slammed at Mardi Gras in 2020, and a lot of susceptible people got it. A lot of people died, and now we're doing well because I think it made its rounds through the most susceptible population a year ago. As far as the third shot, for people that have had COVID or likely had COVID and then had the 2 shots already, I think a third would be a bad idea. I had some pretty significant reactions to the second shot, and if I had a third one, I think I would be extremely ill. So I hope that does not become a mandatory thing. N5RTF.
Okay, thank you there, Chip. Yeah, I can see where anyone who had a bad second shot reaction would be a little bit reluctant to have the third one. And I kind of agree with you. I hope it doesn't become a mandatory thing. If the government wants to make it a voluntary thing for people who are concerned, that would be one thing. But mandatory, I don't think so. And the tourism, the reason why we have the issue here, it's very seasonal. Where in New Orleans, it's not year round. Obviously, you have the Mardi Gras, which is a specific time, but you do get tourism throughout the year. This is probably the lowest time of the year because of the heat, and up here is the highest. But what seems to be also contributing, as I said, is that the limited area that we have, people cannot spread out. And all of the facilities are very small, and people are jamming into them, which appears to be the issue. We're not seeing that kind of problems in areas that are larger, such as other parts of the Cape, such as Hyannis or Falmouth or Chatham. It doesn't seem to be as much of a problem, so they're thinking that it is a geographic issue, and that I'm not sure if that's been an issue. Other places that have small areas like the banks, the Outer Banks, or places like Key West, places like that, I have not heard that. So, does anyone else want to check in before we see that? Very short today, but Anyone else there? Okay. Chip, if you would report tomorrow on the grand rounds that we had 1, 2, 3, 4, 5 of us in a short 15-minute session today. If they want to know what the topic was, you can tell them. I appreciate it. And I guess Jay will be back next week, as far as I know. He hasn't written me, but we'll see. I'll be happy to take it again. So I want to close the net then. Thank everybody and the owners of and the operators of QuadNet for use of the net, and wish everyone a good week. And also a happy birthday to Warren. I'm sure everyone got the emails. Everybody needs to remember tomorrow if they check into the grand rounds to mention that. So this is WA1EXA. We'll be signing off and wish everyone a good week. WA1EXA.
We have been recording the net, and the recording will be placed in the archives in about 5 minutes in 5 RTF clear.
Thank you again, Chip. I didn't hear Hilton on today, so I certainly did not get on. I did want to ask him how things were in Brazil. I understood that they were having a turnaround on their cases also. Thank you again, Chip. WA1EXA.
Papa Yankee 2, Bravo, Bravo, Quebec. Anybody's 2 in the hotline?
WALEXA. Everybody kind of left because there wasn't very much to talk about today, but I happened to be listening, see if anybody showed up. How you doing, Hilton?
Okay, WA1EXA, PY2 BBQ. Sorry I couldn't get into the net earlier. I was in the road coming to Guarujá, which is in the beach, about 100 kilometers from São Paulo. And now I'm Marítimo Mobile, transmitting through the hotspot, and I could turn on the broadcasting via the YouTube remotely from my cell phone. I could access my home computer and turn on the broadcasting. So I was not sure that the net was already over, so that's why I called you. WA1EXA PY2 BBQ.
PY2 BBQ, WA1EXA. Well, the discussion basically was the uptick of the coronavirus and what were some local reasons. We had, let's see, Chip was on, and was saying that there is an uptick. They believe it's because of the tourism. Let's see, Chad was on from Missouri, and he is having a very difficult time. Missouri is very high as far as its new cases. And let's see, we had one, I think of N3IM from Philadelphia, seeing that they're doing okay. Seems to be they're just trying to work on the vaccinations, particularly in the inner city, well, Philadelphia. So that was about what we talked about. I did want to ask you, Bray.
Okay, Mark. Well, 100% copy. WA1EX8 UI2 BBQ returning. And yes, we have this news in the press also. And the news here from São Paulo, from Brazil, I mean, is that we have a great decrease in the new case numbers, in the hospital occupation, and the number of deaths as well. Things seems to be going very well from the last few days, and it's really dropping dramatically. From we peaked like 4,000 deaths daily. The number now is about 500 daily deaths, and the vaccination is going on very well. We have about 90 million people vaccinated at least with the first doses, and 33 million people are fully vaccinated. So more than half of the adult population have already been vaccinated, and it resulted in the decrease of new cases and deaths. So that's the story here in Brazil. Back to you, Mark. WA1EX8 UI2 BBQ.
PY2 BBQ WA1EX8. Well, the story in the States is a little bit different. We've had an increase of 126%, with a decrease of 13% of the tests that were given. Hospitalization has gone up 30%, and the deaths have increased by 23%. But it seems to be all clustered in a few handful of states, mostly in the South. The highest states seem to be Missouri, Arkansas, Louisiana, Florida, and parts of Texas, and parts of one county in Alaska. There has been a report of the increase specifically in one town on Cape Cod, which is Provincetown. If you're familiar with Cape Cod, it's the very last town at the end of the peninsula. But it's a very small town, and it's a lot of tourism this time of year, and they have really no room up there, right? They have very little room up there, and all the restaurants and clubs are very small. So the belief is that just from the crowding into the facilities, it has shown some increase. The rest of the area is it's pretty stable. We have not seen any increase in our hospitalization, and deaths still stay very low, less than 1%. The country has about 63% of the country is vaccinated fully, and more than that with one shot. Of course, there's the question now about Pfizer, and they're trying to get permission for a third shot. We're not sure how that's going. Many of the medical personnel really don't have don't require it, nor do they feel that it's necessary. Right? So it's kind of a big discussion up here. I know listening from the infectious disease people up in Boston, from Tufts and Mass General, they're basically saying they don't feel that it's going to be necessary because the data doesn't show any difference as far as how many people get it, although it does show an increase in antibodies. Not necessarily a measure of how well the vaccine number of people that are going to be covered. I would say that the number of vaccinations have increased at the Delta variant is being controlled. Most of the infections throughout the country are not major and don't require hospitalization, but we do see an increase. Sorry about that. So that's the way things have been going here, and basically it's the states that have the lowest vaccination rate have the highest case rate, and seems to be spreading fairly quickly there. The city of Los Angeles is requiring masks being used again inside, whether you're vaccinated or not. So that's the only area that has the mandatory mask for everybody. That started, I believe, either next Monday or last Monday. I forgot. So back to you. PBY, BBQ, WAVNEXA.
WA1EXA, PY2, BBQ. Oh, thanks for the information, Mark. Very interesting, especially to know that the southern states, and mostly those where there is still resistance with the vaccination, are those states with a higher number of new cases. That's very important information. And we also know that most people that are still dying from COVID-19 are exactly those that refuse to get vaccinated. So that's very interesting that still many people refuses to have a vaccine that is showing to be safe and effective. Although it won't protect you 100%, it will certainly decrease the chance of death and morbidity. So the same is going on here. We hope that in 2 more months we will have the whole country population with at least 1 doses of the vaccine, and that have already changed the game from the last few weeks to now. Wait one. And regarding a third shot of the Pfizer's vaccine, that's a good discussion because we know that the decrease of efficiency of the vaccine is because of different mutations of the virus. So I don't know if a third shot of the same vaccine would increase the protection. We know that there are a new paper in the Nature magazine that was published this week showing long-term cellular memory, immune memory, to assure that you will have a quick antibodies response, even though your titles of neutralizing antibodies have decreased. So I think we should have new shots of vaccines, but new vaccines that could cover new mutations of the virus, as well as it happens with the influenza vaccine yearly. So back to you, Mark. WA1EXA, PY2BBQ.
Before I said, WA1EXA, would you like to add something? WA1EXA.
Yeah, sorry I missed things earlier. I had my hands full here. And, the one other thing that I wanted to add to the mix, not about the vaccine so much, but about resistance to taking the vaccine. There are several areas where outbreaks have occurred, and apparently Delta variant, particularly in an area in Mississippi, has caused the hospitalization and transport to the ICU of 10, possibly more children now. Also, I'm understanding they're watching Florida very carefully because there are actually four areas of outbreak there that seem to be poorly controlled, and of course, resistance to taking the vaccine has been high there. So that's all gleaned from my wife, the pediatric infectious disease specialist. Thought I'd pass that along. And on the vaccine response, the cellular response is typical of many of these viruses like this. I'm not surprised. I also know that both companies here are working on a booster that includes one of the variants. So we'll see what comes out. Before I said.
P4IZ and PY2BBQ, WA1EXA. Okay, very good. And that was another thing I wanted to bring out is that there is a population, at least in the U.S., I don't know about Brazil, that has not been vaccinated, and that's the young children below 12, I believe. And there's quite a concern about going back to school with that group of children, and how resistant or how much of an issue it's going to be, and what the danger level would be. Also, the question about the third shot. Wait one. The question about the third shot is those people who had a bad reaction with the second shot. Maybe not with the first, but with the second shot. The concern is there going to be even a worse reaction if there's a third shot? And there's questions on that too. So it's kind of an open discussion right now. I have not heard about really anything about the younger children in the U.S. Being able to get a dose. I don't know what the dose would probably be less, but I know they've been working on it, but I have not heard anything. But that is going to be a problem within a month or so as they go back to school. And there's a big push to have everybody go back to school. So we expect that will happen. And even though that we want to bring it up, there is more than just a medical concern about people that PY2BBQ, WA1EXA, you still there?
Okay, W1EXA, PY2BBQ. I think I lost the last part of your transmission. I don't know if you're catching the TOT. But yes, I heard about the pediatric population here in Brazil. We are planning to vaccinate the adolescents in the following weeks. The vaccination age here is around 30 years old and up. We expect to vaccinate the whole adult population in the next 2 months, and then start vaccinating adolescents, and at least adolescents. That's the plan here from the medical authorities. We don't see much problem with the pediatric population so far, but the children is coming back to school, and not full time, but 2 or 3 days per week, and the rest of the time they're studying at home. And certainly we may have some change in this pattern among the children as they go back to school. So wait, what? As I told you, I'm in the sailboat right now, and I'll have to leave you. And thank you very much for this opportunity again this week. Hope to meet you again in the following Saturday, next Saturday, and have a nice weekend, you all with your family. Okay, back to you, Mark. WA1EXA, PY2BBQ.
PY2BBQ, WA1EXA, and K4IZ. Okay, Hilton, have a good week also. Yeah, here we're inoculating from 12 and up. I have not found any big problems with that, so it's been an experience, and we're now looking at 12 and lower as far as the age group. KD4IZ, did you have any other comments, Glad?
Yeah, I know you didn't, Mark. And thank you for running things today. I'm glad you had stuck around. I was hoping that the conversation would go on, but apparently, with the summer holidays and the post-4th of July travel and all that, there's folks who are out of pocket, so not in here. I probably will be here next week. I don't know for sure. But I'm hoping that that situation makes itself clear. I may be driving down to North Carolina over the weekend. I hope I am not. I'd like to hold off until the following Monday before going down. Some of that depends on my father's schedule and some of the other folks I'm planning on visiting while I'm down there. Well, you all take care. I'm going to go ahead and sign with this. And Hilton, it was great to hear you have fun on the sailboat. You're doing one of my favorite activities. If I ever get down that way, we'll have to go for a sail together. KD4IZ, back to you, Hilton, and Mark, you can wrap it up. I'm going to go ahead and sign.
Okay, excellent. Good to know that you're also a sailor and you like sailing. If you come down here to Brazil, you're already invited to do some sailing with me. Okay, I don't know if you have already seen the CureZ page. I have a nice photo of the Bon La Vie sailboat where I'm right now. And I am managing to put up the HF station here also. I hope in the next few weeks I'll install a Nikon IC706 with a long wire antenna and try to do some BOTA, no, not boats on the air, here from the Buena Vista boat. So thank you all. 73s and have a great weekend. Back to the net control. There's WA1 EXC, PY2 BBQ. Bye bye.
Okay, PY2 QW, and ND4IZ, WA with EXA. Very good, guys. As you know, we have lots of sailboats up here too, but I'm not a sailor. But if anybody finds their way up to the Cape, please let me know. I'd love to try it, and I'd love to meet with you guys. Though it's quite a sail for you, Hilton. Probably months long. 73, enjoy, and we'll talk to you hopefully next week. WA when you safe.